The practicum project being created is a 16-week program which will contain 4-hour weekly learning modules delivered by the emergency department nurse educator. Some of the topics to be covered during this program will be care of the cardiac, trauma, and critical medical patients, with additional modules covering specialties such as the mental health, pediatric, and obstetric patients. Special learning experiences will also be offered in the cardiac catheterization lab, a ride along with the local fire department's EMS unit, and an observation experience in the birthing in. The program goal is to offer comprehensive training on the specifics of emergency nursing, in addition to completing the required new graduate nurse hospital orientation program. This week's learning module covers cardiovascular emergencies and will discuss assessment and interventions for patients complaining of chest pain, acute myocardial infarction, cardiac arrest, congestive heart failure, pericarditis, and hypertensive crisis. The learning modules will occur in a synchronous modality, with the graduate nurse cohort being scheduled off unit for the weekly learning modules to allow for face-to-face interaction with the department educator. This week's overall objectives for the cardiovascular emergencies module will include a review of pertinent anatomy and physiology and a discussion of the assessment and treatment for patients complaining of chest pain, congestive heart failure, acute myocardial infarction, cardiac arrest, hypertensive crisis, and other cardiovascular emergencies in the emergency department. ADDIE has been chosen for the instructional design model, which stands for Analysis, Design, Development, Implementation, and Evaluation. ADDIE represents a dynamic, flexible guideline for building effective training and performance tools. During analysis, an instructional problem is identified, instructional goals and objectives established, and the learner's existing knowledge and skills identified. During design, learning objectives, assessment instruments, exercises, content, lesson planning, and media selection occur. The development phase is where creation and assembly of the content takes place. Implementation is where the educators become familiar with the course curriculum, learning outcomes, method of delivery, and testing procedures. Finally, evaluation, both formative and summative, occurs. Actually, formative assessment occurs during each stage of the ADDIE process, where summative assessments usually occur at the culmination of a learning experience. These 5 phases of ADDIE have occurred for each week's learning module, in addition to the ongoing process of practicum project revision. New graduate nurses have generalized knowledge of the nursing care of patients, but are not familiar with the specialized care that emergency nursing requires. This lack of knowledge was identified in the population of graduate nurse orientees in the emergency department, and the program is being designed to meet this need. Each week, the design phase incorporates teaching strategies based on the chosen subject matter. Education is developed, implemented, and an evaluation of the student's knowledge and course effectiveness are measured. Bloom's taxonomy is a framework to promote higher forms of thinking in education, such as analyzing and evaluating rather than just memorizing facts, and was created by Dr. Benjamin Bloom in 1956. It is used often when designing educational processes. The 3 domains of learning in Bloom's taxonomy are cognitive, affective, and psychomotor, otherwise categorized as knowledge, attitudes, and skills, and are the goals of the learning process. Therefore, after completing a learning experience, the student should have acquired a new skill, knowledge, and/or attitude. When creating lesson plans, it is important to classify the behavioral learning objectives according to the domain in which they most identify with to ensure a learning experience involves multiple domains. The instructional methods used are lecture, group discussion, case study review, and role play of patient assessments. This variety will appeal to learners with visual, auditory, and kinesthetic learning styles. It is crucial to use several different teaching strategies in each learning experience to reach all learners, since they will all learn best by different styles. Students learn least by lecture alone, and best when lecture is combined with additional hands-on teaching methods, including teaching a peer what they have learned. The lesson plan for the cardiovascular emergencies module contains 6 objectives with associated content, teaching strategies, and evaluation methods. The first objective is upon completion of the lecture, the learner will identify 5 common presenting signs and symptoms in patients with cardiovascular emergencies. This is in the cognitive domain at the level of knowledge. The industry standard is evidence-based practice. Content to be covered will be cardiovascular emergencies, including acute coronary syndromes, acute myocardial infarction, cardiac arrhythmias, cardiac arrest, congestive heart failure, pericarditis, aortic aneurysm, and hypertensive crisis. Time allotted will be 90 minutes. This is primarily lecture via PowerPoint, and a written exam with multiple choice questions will be passed with at least an 80% accuracy. Objective 2. Upon completion of the learning module, the learner will demonstrate proper patient assessment technique as it applies to care of the chest pain patient in the emergency department on another learner in the class. This is a psychomotor domain at the level of guided response. The industry standard here is patient-centered care and evidence-based practice. Content outline for this will be assessment of chest pain patients, including immediate assessment, ABCs, vital signs, pulse oximetry, applying the cardiac monitor, initiating an IV, performing a 12-lead EKG, obtaining labs including cardiac biomarkers, creating a differential diagnosis, administering any necessary medications or other treatments. Time allotted here will be 30 minutes. Teaching strategy is role play, and evaluation is a return demonstration with 90% accuracy. Third objective is upon completion of the learning module, the learner will differentiate between the symptoms of acute myocardial infarction, congestive heart failure, and hypertensive crisis with 90% accuracy on a written evaluation. This is in the cognitive domain at the level of analysis. Industry standard is evidence-based practice, and content will be comparison of signs, symptoms, and assessment findings, including acute myocardial infarction, congestive heart failure, and hypertensive crisis. Time allotted for this will be 30 minutes. This will be lecture and discussion, and a written exam with multiple choice questions passed with at least an 80% accuracy will be the evaluation method. Objective 4 is during a discussion session, the learner will verbalize any feelings of discomfort in allowing family presence during a cardiac arrest resuscitation. This is in the affective domain at the level of responding. Industry standard here is patient-centered care, and items covered will be common feelings regarding family presence during resuscitation, including fear, anxiety, disbelief, grief, and acceptance. Time allotted will be 30 minutes. It'll be group discussion, and evaluation will be active participation in the group discussion. Objective 5, upon completion of the learning module, the learner will demonstrate proper placement of defibrillation pads and use of an AED on a mannequin using the defibrillator with 100% accuracy. This is in the psychomotor domain at the level of guided response. This will also be safety and evidence-based practice industry standards. Content will be review of the steps for application of defibrillation pads and use of an AED. The student will need to determine pulselessness, prepare the patient, locate equipment, apply pads, connect the AED, and follow the prompts. Time allotted here will be 30 minutes. This will be demonstration, and evaluation will be a return demonstration with 100% accuracy. And the sixth and final objective is after participation in a group discussion regarding care of a patient in congestive heart failure, the learner will justify their treatment of this patient while following the approved congestive heart failure physician order set. This is a cognitive level for domain of learning at the level of evaluation. Industry standard is evidence-based practice, and content covered will be review, treatment of patients with congestive heart failure, including their assessment, history, medications, and the physician order set content. Time allotted here, 30 minutes, primarily group discussion, and evaluation will be active participation in the group discussion. Total time allotted for this learning module will be 4 hours. The students will have to read Chapter 31 in the Sheehy's Emergency Nursing Care and Practice book that they will be provided at the beginning of the orientation module.